Zambi wabukola wikala neto.
Bonjour à tous.
Bonjour ma papa, ma maman.
Bonjour à tous, bonjour les amis de Walesa.
Je viens juste vous annoncer qu'il y aura un grand événement qui va se dérouler à Montréal. L'évangéliste Kambou de Walesa va venir faire une grande conférence ici. Donc j'invite tout le monde, les jeunes, les papas, les vieux, tout le monde.
Montréal, na Canada.
Venez, parce que ça sera un temps de guérison, un temps de miracle. Vous qui avez des problèmes, vous qui, je ne sais pas quelle situation vous avez actuellement, venez.
Problème, songolo pakala, maladie songolo, oh, kendo hôpital mo anakateyaka. Pour le boko la nzambe za moku c'était pour na kobikisa.
L'adresse ça sera au 6700 rue Transcanadienne, Montréal, Québec, à l'hôtel Odeli.
Mokolo wana ezali le 7, le 8, le 9
juillet.
Boya boza décité.
Pour toute réservation pour les chambres d'hôtel, nous avons 3 hôtels à vous proposer. Le Holiday Inn, lieu où se déroulera la convention. Pour toute réservation de chambre, composez le 1-867-660-85-50. Mentionnez le groupe Les Amis de Walesa. Le Comfort Inn en composant également le 1-800-267-38-37 en mentionnant le groupe Les Amis de Walesa. Et le 3e hôtel, Quality Suite, en composant le 1-800-267-38-37 et vous mentionnez le numéro de groupe 28 24 789.
Avec l'évangéliste Kambou Walesa, vous allez avoir la solution. Ici, Antonio Cavavi à Montréal.
Charisme.
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 So JPS has been working with us on our Aspirin for Africa project that we're working with. So they've been showing tours and some of the trainings that we're changing information with the Democratic Republic of Congo to help their doctors and others learn some of our latest techniques and tools. So keep us lifted as we continue to push this.
Thank you for sharing.
Thank you so much. As MP, like Congressman here, I'm also the chair of social committee. Inside, I'm involving about the case of health social law. So that's why I'm very, very interested to come here to see how we can share together some different kind of service we can give to our patients, like in Congo. We have tropical disease. I don't know how do you provide medication for tropical disease here. We have so many Congolese here. So sometimes they can come in Congo for the, to meet a family or for a different trip. So when they come back here in the United States, they can be sick of malaria, on different kind of tropical disease. I don't know how do you provide it. We want to make sure that you can also. I'm sorry for my broken English, but I understand. Thank you so much. Though that's why we expect that it's also possible to have a doctor here who can come in Congo to learn, to see, to know how we are doing with a small possibility we have, but we are able to keep care of people. So, okay.
Very good. Thank you so much. Awesome. Thank you. Thank you so much. A pleasure to meet you. Take care. Thank you. Thank you so much. Thank you. And I'm sure that we'll be happy to partner with you. Thank you. Take care.
Thank you.
Good afternoon. Happy Friday. Thank you so much.
So My name's Chris Wall. I started out as a staff nurse here. I'm just kind of working my way up. I'm a project director now, and I work mostly with our outpatient group. Most people ask what a project director is. I tell them I do what I'm told. It works at home and it works here. So a little bit about us. We have 132 inpatient psychiatric beds located here. 96 of those are straight down this tunnel. That's a quarter-of-a-mile walk down that tunnel. So we get our steps in. We have a psychiatric emergency room that works just like in a medical emergency room, but for psychiatric emergencies, which is located on the 10th floor of the main building. And this is actually the route that we transport our patients to get to the inpatient facility. About 4 blocks down the road, we have another inpatient facility that has another 36 beds that were added in January of last year to add more capacity. That ended up giving us about 30% more capacity for our inpatient psychiatric beds. We stay full every day. There's not a day that we don't. So out of that, we have 16 adolescent inpatient psychiatric beds. Those 16 beds are for children 13 to 17. They go to school while they're here. We contract with Fort Worth ISD to provide that schooling. There's 2 special education educators that are certified in special ed to help them with their schooling. They get administratively transferred into Fort Worth ISD, and then when they leave the hospital, they're transferred back to their original school. So they literally miss no days of school while they're here. Also, their standardized testing, like the STAR testing here in Texas, that is still administered while they're in the hospital. So you can't get out of it. But on top of that, we have 80 other adult beds that we try to break up based on acuity. So we have a very high acute unit, which is really the entrance to our inpatient facility, and then we have a couple of step-down units. As people start to stabilize, they can process more in groups and get a little bit more activity-based therapies. And then in our building that's got the 36 beds, that's actually where we keep our longer-term patients that are committed. There's a commitment that can last up to 90 days, and we call that the local commitment alternative unit. And those are contracted beds to try to meet some of the demand. The state hospitals have to prioritize more of the criminal commitments for behavioral health, stabilization, and competency restoration. So we are managing more of the civil commitments here in Tarrant County. And that's a huge resource, and there's 28 of those beds are for that. And then in our clinics, we have 6 behavioral health clinics that are available in our community. After they're discharged, they can follow up there, as well as there's some people who never are inpatient that receive their treatment and their psychiatric stabilization at those clinics. We also partner with our primary care doctors at our primary care clinics to work on depression screenings, because most people don't show up and say, geez, I need to see a psychiatrist. Most people show up to their medical doctor and say, I don't feel well, I'm tired, I'm not sleeping. And then their medical provider starts that screening. If they're depressed, they'll start them on an antidepressant, and we work with them to help with some of that mild and moderate depression. So that, in a nutshell, is a little bit about behavioral health. Anybody have any questions or other information they'd like to know?
And if y'all think of something afterwards, I'm happy to get those questions over to Chris. Thank you, Chris.
All right. Well, I hope y'all have a happy Friday.
Same to you. Thank you so much. Thank you, Chris.
Well, so it gets a little bit more cramped.
I know. To ask a question.
Yeah, they said
We've been training on the democracy, because they've been independent for 60 years, but they're still so sophisticated. They have $27 trillion worth of natural resources. $27 trillion. I'll give you my number.
appreciate your time. Thank you so much. It's such an honor to meet you. Thank you so much. Such an honor. Thank you. So nice to meet you. Nice to meet you. Hey, Reverend.
Hello. Hi, my name is Mia Hall. I'm with Fort Worth ISD. I am the Director of Policy and Governance, and I also serve in Crowley ISD on the school board. And I feel so fortunate to be here today at JPS during the visit in which I got to meet this wonderful woman here, and I look very forward to the opportunities to partner in the future and see how we can help. Thank you so much. Thank you.
I just want to say may God bless the country and Godspeed with those that are suffering with diseases, and I wish you all the best in finding the latest in medicine to advance. So God bless.
Hi, I'm Reverend K.F. Tatum here with the Aspirin for Africa Project, and we're excited to have the General Secretary and Senator here in Fort Worth at John Peter Smith Hospital, the place in which I was born, December the 19th, 1965. But it's good to be here today to be able to make partnerships between those of us African Americans here in Fort Worth with our African brothers and sisters to try to bring about improvement in health and economic wherewithal with our brothers and sisters from the Congo. So we're so honored to have you here. We're praying, Doctor, that this is the beginning of something that will last long after we're gone, and that children and mothers who have not had access in the past will begin to gain access to our support and help. So thank you for your fight in the struggle. Thank you for your fight, help, and we look forward to great things.
Exactly. Thank you so much. Oui, nous sommes venus visiter l'hôpital JPS en notre qualité personnellement comme député national. Je suis dans la commission socio-culturelle et surtout présidente d'une commission, la commission socio-culturelle. Là-dedans, il y a des questions de santé, d'éducation, d'emploi, mais la santé est prioritaire. Sans la santé, on ne peut rien faire. C'est la raison pour laquelle nous sommes venus voir comment ça se passe, comment les autres évoluent. Je sais que nous avons des hôpitaux chez nous au Congo, mais certainement la manière de prise en charge diffère. Raison pour laquelle à tout moment, il y a des Congolais qui en ont les moyens, qui vont se soigner à l'extérieur. Qu'est-ce qui s'est fait que chez nous, nous ne pouvons pas avoir le même structure qui permettre la prise en charge médicale à un coût moindre, et surtout que quand on est soigné à l'hôpital, on est proche de sa famille, c'est toute une thérapie, alors que quand on vient se soigner en dehors du pays, c'est vrai, ça coûte aussi cher, mais c'est très difficile parce que vous êtes pratiquement détaché de la famille. Un autre volet, je voudrais savoir ici, il y a beaucoup de Congolais, il y a beaucoup d'Africains qui viennent souvent en Afrique, qui viennent au Congo. Comment est-ce que les cas de maladies tropicales sont pris en charge ici, dans ces pays? Nous avons visité et nous avons vu. Je crois que l'échange d'expérience entre les médecins congolais et les médecins d'ici, ça serait une très bonne chose. Merci.
Sur demande de messieurs, et nous sommes très émerveillés par rapport à ce que nous avons vu ici. Ce sont des services qui sont répartis en bonne et due forme, et nous avons voulu à ce que nous puissions nous imprégner des services, comment ça se passe, et nous avons eu suffisamment d'explications. Par rapport à ces explications, moi j'ai retenu deux choses tout à fait importantes. La première chose, c'est que les services des urgences, au niveau des services des urgences ici, on est en train de tout recueillir, du sang. On intervient en urgence concomitamment avec les pathologies au niveau du cœur. Et c'est ce que nous avons retenu. De l'autre côté, nous avons retenu aussi qu'ici, on soigne non seulement le corps humain, mais on s'occupe aussi de son spirituel. Le côté spirituel est pris en compte ici dans cet hôpital. C'est pourquoi nous en sommes très émerveillés. Nous avons voulu demander à monsieur qui nous a fait le guide de pouvoir bien nous venir en aide, nous qui sommes dans des pays africains, nous qui sommes au Congo spécialement, parce que chez nous, il y a un temps, c'est l'homme blanc, quand il est venu nous coloniser, c'est l'homme blanc qui a dû construire des hôpitaux. Et depuis que l'homme blanc est parti, aujourd'hui nous en sommes à 80 millions d'habitants, Je crois que les constructions des bâtiments des hôpitaux ne suivent pas la démographie que nous sommes en train d'observer chez nous. Et c'est toute la difficulté que nous avons. C'est pour ce faire, nous sommes présentés ici pour d'abord nous imprégner de la façon dont l'hôpital est géré, ensuite les techniques médicales. Nous avons appris beaucoup de choses dans cet hôpital. Je n'aimerais pas tout dire ici, sincèrement. Je remercie les gens qui nous ont permis de connaître cet hôpital. Et ce n'est qu'une partie remise. Je crois qu'à la prochaine, on va approfondir nos entretiens. Je le remercie très sincèrement.